Hey everyone, and welcome back. Today we are going to get into something pretty much all of us have felt at some point. We're demystifying those common stomach medicines you reach for when heartburn strikes. Let's find out what's really happening inside your body when you take one.
You know that feeling, right? That awful burning sensation, the discomfort? You pop a pill and poof, relief. But how? What is the actual science behind that quick fix? Well, that's exactly what we're going to unpack today.
So, to really get a handle on the medicine, we first have to understand the stomach itself. And honestly, the best way to picture it is as this super sophisticated, really powerful acid factory. Now, the main gig for this factory? Pumping out hydrochloric acid. It's absolutely essential for breaking down your food and getting those digestive enzymes fired up. But, just like any factory, sometimes production goes into overdrive. And that's when the trouble begins. Okay, so check out the factory's chain of command. It's actually a really cool, logical system. First up, you have the G cells. Think of them as the shift foreman. They send out the start production signal, which is a hormone called gastrin. That signal zips over to the ECL cells, which then shoot out a chemical memo, histamine. Finally, the parietal cells, our workers on the factory floor, they get that memo and bam, they flip the switch on the acid pumps. All right, so what happens when the factory is just making way too much acid, causing things like GERD or ulcers? How do we dial it back? This is where our different management strategies, our medications, come into play. First on the scene, we've got antacids. Just think of these guys as the factory's emergency cleanup crew. They're not there to stop production. They just rush in and neutralize all the acid that's already been spilled. This is exactly why they give you that super fast, but, pretty temporary relief. They're just mopping up the mess, not fixing the leak. But this cleanup crew, they're not perfect. And to remember the possible side effects, just think of the mnemonic bad C. The B is for bloating. Yeah, thanks to those carbonate-based antacids. A is for acid rebound, where your stomach kind of freaks out and overcompensates later. The D can stand for diarrhea or constipation, just depends on the kind you take. And that last C is for a potential calcium imbalance if you're using them a lot.
So the big takeaway here is that antacids are for that right now, immediate cleanup. But what if you want to stop the spill from happening in the first place? Well, that's where H2 blockers come in. They're a bit more proactive. They take a little longer to kick in, but their effects stick around for a lot longer.
So how do H2 blockers work? Simple. They cut the factory's communication lines. Remember that chemical memo, histamine, that tells the parietal cells to get pumping? H2 blockers basically intercept that message. They block the H2 receptors so that make more acid order, it just never gets delivered. And production slows way, way down. Okay, so cutting the signal is pretty effective, but what if you need to shut things down even more? That brings us to our third class of drugs, the big guns, proton pump inhibitors or PPIs. While H2 blockers are messing with the signal, PPIs go straight to the source and just turn off the machines. And this is where you see their real power. PPIs are like the ultimate intervention. They march right up to those parietal cells and directly block the H plus K plus ATPase enzyme. That's the literal proton pump. It's like walking onto the factory floor and slamming the big red emergency stop button on the main assembly line. The result? A really profound, long-lasting shutdown of acid production. Now, because PPIs are so powerful, using them long-term can come with a bigger list of potential issues. A good way to remember this is with the mnemonic had GI issues. H for headache, A for abdominal pain, and D for diarrhea are pretty common. But the long-term stuff is what you really want to know. G for GI infections, I for an increased fracture risk because of reduced calcium absorption, and that last I is for iron deficiency. Okay, so far we've talked about two main strategies, either neutralizing acid or stopping it from being made. But there's a whole other way to tackle this. What if we could just protect the factory walls from the acid? This is where Sucralfate comes in. And this one is a total game changer because it's completely different. It doesn't touch the acid levels at all. Nope. Instead, its job is to act like a biological band-aid. It creates a physical shield over damaged spots, like ulcers, protecting them from that corrosive acid so they can actually get a chance to heal. So how on earth does it do that? It's pretty amazing, actually. When sucralfate hits the acidic environment of your stomach, a chemical reaction turns it into this thick, sticky paste. This gel-like stuff is naturally drawn to the raw, damaged tissue of an ulcer, and it sticks right to it, forming this protective patch. It's like a perfect little shield that covers the wound so it can heal underneath, safe and sound. So we've pretty much covered how to manage the acid factory itself. But what about problems that are coming from, let's say, the factory's control room, the brain? Let's switch gears and talk about another really common issue, nausea and vomiting, and the drugs we use for that, the antiemetics. All right, let's meet our nausea control team. It's super helpful to see them laid out like this. First, you've got the 5-HT3 antagonists. These guys block serotonin receptors and are absolute lifesavers for nausea from things like chemo or surgery. For side effects, just remember head for headache. Next up, the dopamine antagonists. They target dopamine receptors and work great for GI issues and migraines. Their big side effect, sedation, so the mnemonic is easy, sedate. And finally, for stuff like motion sickness or vertigo, you've got your classic antihistamines. They block histamine receptors, and you can remember their side effects with SAD. That's sedation, anticholinergic effects, like dry mouth, dizziness, and drowsiness. Okay, we have covered a ton of ground, right? From the emergency cleanup crew to shutting down the whole assembly line all the way to the control room team. Let's pull this all together into one simple, final toolkit. And here it is. This is your ultimate takeaway guide. Think of it this way. If you need fast relief, you call the cleanup crew. That's your antacids. If you want to reduce production, you cut the communication lines with H2 blockers. For the most powerful shutdown, you shut down the pumps with PPIs. And if you need to heal an ulcer, you apply a protective patch with Sucralfate. See? Each tool has a very specific job in managing our little acid factory. And at the end of the day, that's really what this is all about. When you understand the mechanism, the how, and the why, it just empowers you, right? It takes medicine from being this big mystery and turns it into a tool that you can actually understand and use wisely. So there you have it. You are now officially equipped with the knowledge of how these super common GI meds really work inside your body's amazing chemical factory. So what complex system should we break down next time? Let us know what you're curious about. Thanks for tuning in.